There is a quiet shift that happens in many long term relationships, one that often goes unnamed and unexplored. It doesn't arrive suddenly or dramatically. Instead, it settles in gradually, woven into the routines of everyday life. A couple who once felt effortlessly connected may begin to notice subtle changes. Conversations remain warm, companionship stays strong, but intimacy begins to feel different. It becomes less frequent, less spontaneous, sometimes even something that is gently avoided rather than eagerly anticipated. What makes this shift particularly complex is that it is rarely discussed openly, even between partners who care deeply for one another. In many cases, people instinctively search for explanations outside themselves. A partner may wonder if the other person is less interested, less attentive, or less attracted. It is common to assume that relationship stress, aging, or emotional distance must be the cause. These are understandable thoughts because for generations, conversations about sexual health have been limited, incomplete, or surrounded by discomfort. When something changes, we tend to reach for the explanations we know, even if they are not entirely accurate. Consider a woman in her early 50s who has spent decades in a loving marriage. She begins to notice that her desire for intimacy is not what it once was. There is no major conflict in the relationship, no obvious loss of affection, yet something feels different. She may quietly attribute this change to her partner, wondering if he is less engaging or if the spark has simply faded with time. What often goes unrecognized in this moment is that her body, particularly her brain, may be undergoing natural biological changes that influence desire in ways that are both real and medically understood. This is where the conversation becomes both more interesting and more important. Sexual health is not separate from overall health. It is not an optional or superficial aspect of well being. It is deeply connected to the body's systems, including hormones, blood flow, nerve function, and emotional processing. Yet, despite this, it has historically been treated as something secondary, especially when it comes to women. While men's sexual health challenges, such as difficulty with erections, have become more widely discussed and researched over time, the same level of attention has not always been given to women's experiences. Part of this imbalance comes from history. There was a time when even discussing sexual concerns was considered inappropriate. Over time, certain conditions gained visibility because effective treatments became available. Once there was a solution, conversation followed. But for many aspects of female sexual health, answers were slower to develop, and as a result, the silence persisted. When healthcare providers feel they have limited tools to offer, they may avoid initiating conversations. And when patients sense hesitation, they may choose not to bring up concerns at all. This silence creates a cycle. Women may experience changes in desire, arousal, or comfort without understanding why. They may blame stress, aging, or their relationship. Some may simply accept the changes as inevitable, even when they cause distress. Others may adjust their behavior in subtle ways, going to bed earlier, staying busy, or avoiding situations where intimacy might be expected. These adjustments are rarely discussed openly, but they can shape the emotional landscape of a relationship over time. What makes this particularly significant is that these experiences are not rare. They are common and they are often treatable. There are recognized medical conditions such as low sexual desire that is not explained by relationship issues alone that can affect how a person experiences intimacy. These conditions are not a reflection of character, commitment, or attraction. They are rooted in biology, including changes in brain chemistry and hormone levels that occur naturally across the lifespan. At the same time, cultural factors play a powerful role. Many women grow up without clear education about their own anatomy or sexual health. Even the language used to describe the body can be vague or inconsistent, making it harder to articulate concerns. If someone cannot clearly describe what feels different or uncomfortable, it becomes much more difficult to seek help. This lack of foundational knowledge can create uncertainty, embarrassment, and hesitation, all of which contribute to delayed or missed care. The generational gap in communication further adds to this complexity. In many families, topics related to menopause, desire, or sexual comfort were rarely discussed openly. A woman may remember seeing her mother go through physical changes, such as hot flashes or sleep disturbances, without ever hearing a conversation about what those experiences meant. Without shared stories or guidance, each person is left to navigate these changes largely on their own, often relying on fragmented information or assumptions. Yet, when these conversations do happen, even in small ways, they can be transformative. A patient who finally feels comfortable sharing her experience with a healthcare provider often expresses relief, not just because she may receive treatment, but because her experience is validated. She realizes that what she is feeling has a name, a biological basis, and importantly, potential solutions. This shift from confusion to understanding can change how she views both herself and her relationship. It is also important to recognize that intimacy does not have an expiration date. There is a common misconception that sexual activity naturally disappears with age, but this is not supported by what we see in clinical practice or research. Many individuals continue to have fulfilling, intimate lives well into later decades. The key factor is not age itself, but overall health, communication, and access to appropriate care. If a person is physically able to engage in daily activities without significant limitation, there is often no medical reason to avoid intimacy. This perspective challenges a deeply ingrained belief that aging and sexuality are incompatible. In reality, intimacy can evolve rather than disappear. It may look different, require more intention, or involve new approaches, but it remains a meaningful part of life for many people. When we begin to see sexual health as an ongoing aspect of well being rather than a phase that ends at a certain age, it opens the door to more honest, supportive conversations. At its core, this topic is about understanding the human experience in a more complete way. It is about recognizing that changes in desire, comfort, or connection are not simply personal failings or relationship flaws. They are often signals from the body reflecting shifts that deserve attention and care. By approaching these changes with curiosity rather than judgment, we create space for better communication, more accurate diagnosis, and more effective support. As we move forward, it becomes essential to explore not just the emotional and relational aspects of these experiences, but also the underlying biology. Understanding how hormones, brain chemistry, and physical health influence sexual function can provide clarity and direction. It allows both patients and clinicians to move beyond assumptions and toward solutions that are grounded in science and compassion. As we begin to look beneath the surface of these experiences, the picture becomes clearer and, in many ways, more reassuring. What often feels confusing or even isolating is, in reality, part of a complex but understandable interaction between the brain, hormones, and the body. Sexual desire, for example, is not simply a matter of mood or personality. It is influenced by chemical signals in the brain, levels of circulating hormones, the health of tissues, and even past experiences. When any one of these elements shifts, the overall experience of intimacy can change as well. One of the most commonly misunderstood aspects of sexual health is desire itself. Many people assume that desire should always appear spontaneously, as it might have earlier in life. However, desire can take different forms. In some individuals, particularly as they age or move through hormonal transitions, desire becomes more responsive rather than spontaneous. This means it may emerge after intimacy begins rather than before. Without understanding this distinction, a person might mistakenly believe that something is wrong, when in fact their body is simply responding differently than it used to. Hormones play a central role in this process. Estrogen, testosterone, and progesterone are not just reproductive hormones. They influence brain function, energy levels, mood, and the health of genital tissues. As individuals approach midlife, these hormone levels begin to fluctuate and eventually decline. In women, this transition is most commonly associated with menopause, a natural stage that marks the end of ovarian hormone production. While many people associate menopause primarily with hot flashes or changes in menstrual cycles, its effects extend far beyond those early symptoms. Over time, lower estrogen levels can affect the tissues of the vagina and surrounding areas, making them thinner, less elastic, and more prone to dryness. This can lead to discomfort or pain during intimacy, a condition that is far more common than many realize. What is important to understand is that pain is not something to accept or tolerate. It is a medical signal that something needs attention. When intimacy becomes uncomfortable, the brain naturally begins to associate it with discomfort rather than pleasure, which can further reduce desire. This creates a cycle where physical changes and emotional responses reinforce each other. Testosterone, often thought of as a male hormone, is also present in women and plays a meaningful role in sexual desire. As levels decline with age, some individuals notice a decrease in interest, even if their relationship remains strong and supportive. This is not a reflection of emotional disconnection, but rather a biological shift. Recognizing this distinction is crucial because it allows for a more compassionate and accurate understanding of what is happening. There are also conditions specifically defined within sexual medicine that help clinicians better understand and treat these experiences. One such condition involves persistently low desire that causes distress and is not explained by relationship issues alone. In these cases, the brain's signaling pathways related to motivation and reward may be functioning differently. This is not something a person can simply think their way out of, nor is it resolved by willpower. It is a medical condition, and like other health concerns, it can be addressed with appropriate care. At the same time, it is rarely just one factor at play. Emotional well being, relationship dynamics, stress levels, and physical health all contribute to how a person experiences intimacy. For example, someone dealing with chronic fatigue, anxiety, or pain in another part of the body may find it difficult to engage in or enjoy sexual activity. Even something as seemingly unrelated as joint discomfort or sleep disturbances can influence desire by affecting overall energy and comfort. This is why a comprehensive approach is so important. In clinical practice, when someone seeks help for changes in their sexual health, the goal is not to focus on a single symptom in isolation. Instead, it involves understanding the full context of their life. This may include discussing medical history, medications, emotional health, relationship satisfaction, and physical comfort. Sometimes a person may come in with one concern, such as recurrent urinary discomfort or vaginal dryness, only to realize that these symptoms are also affecting their intimacy in ways they had not fully connected before. Treatment options have evolved significantly over time, although awareness of them has not always kept pace. Hormone therapy, when appropriate and carefully monitored, can help restore balance and improve symptoms related to menopause. Local treatments, such as medications applied directly to the vaginal area, can improve tissue health and reduce discomfort. There are also medications designed to address the brain pathways involved in desire, offering another avenue for individuals who experience persistent low interest. In addition to medical treatments, therapeutic approaches can be highly effective. Working with a trained therapist who specializes in sexual health can help individuals and couples navigate emotional and relational aspects of intimacy. This might involve improving communication, addressing misconceptions, or exploring ways to rebuild connection and comfort. In many cases, combining medical treatment with therapy leads to more comprehensive and lasting improvements. It is also worth addressing some of the common myths that continue to shape how people think about sexual health. One widespread belief is that using lubricants or other aids indicates a problem. In reality, these tools can enhance comfort and pleasure for many individuals, regardless of age or health status. Similarly, there is a misconception that relying on external stimulation, such as vibratory devices, diminishes natural response. Evidence and clinical experience suggest otherwise. These tools can be part of a healthy and satisfying intimate life. Another important point is that there is no single definition of what is normal. Sexual experiences vary widely from person to person. What matters most is whether an individual feels satisfied and comfortable. A change becomes a concern when it causes distress or affects quality of life. This perspective helps shift the focus away from comparison and toward personal well being. Communication remains a cornerstone of addressing these issues. Many individuals hesitate to discuss changes in their sexual health, even with their partners. This silence can lead to misunderstandings, where one partner assumes rejection while the other is struggling with physical or emotional changes they do not fully understand themselves. Opening this dialogue, even in small steps, can reduce tension and create opportunities for mutual support. As we continue to explore this topic, it becomes clear that sexual health is not a separate or secondary concern. It is deeply integrated with physical, emotional, and relational health. Understanding the underlying biology and the range of available treatments allows individuals to move from uncertainty to empowerment. Instead of accepting changes as inevitable or unchangeable, they can begin to see them as manageable aspects of health that deserve attention, care, and respect. As understanding deepens, the conversation naturally shifts from what is happening to me to what can I do about it. This is where sexual health becomes not just a topic of explanation, but one of empowerment. The goal is not perfection or returning to some earlier version of oneself, but rather creating a version of intimacy that feels satisfying, comfortable, and meaningful in the present stage of life. That process begins with small practical shifts in how we think, communicate, and care for our bodies. One of the most important steps is simply recognizing that your experience matters. Many people minimize their concerns because they assume that changes in desire or comfort are just part of getting older and therefore not worth addressing. But discomfort, disconnection, or distress around intimacy is not something anyone needs to silently accept. Just as you would seek care for persistent fatigue or chronic pain, it is entirely appropriate to seek support for changes in sexual health. This shift in mindset alone can be transformative because it opens the door to solutions. Communication, both with yourself and with your partner, plays a central role. It is not uncommon for couples to avoid talking about intimacy out of fear of hurting each other's feelings or creating tension. However, silence often leads to greater misunderstanding. A partner may interpret a lack of interest as rejection, while the other person may be quietly struggling with physical discomfort or low desire that feels difficult to explain. Creating a space for honest, gentle conversation can reduce this gap. It does not require perfect words, just a willingness to share and to listen without judgment. In many cases, reframing expectations around intimacy can also be helpful. The idea that sex must always be spontaneous or follow a specific pattern can create unnecessary pressure. In reality, planning intimacy can be a practical and even beneficial approach, especially as life becomes busier or as the body requires more time to respond. Setting aside intentional time allows both partners to prepare mentally and physically, which can improve comfort and enjoyment. This is not about making intimacy feel routine, but about giving it the attention it deserves. Equally important is expanding the definition of intimacy itself. Physical connection does not have to be limited to one specific act. Touch, closeness, shared experiences, and emotional connection all contribute to a fulfilling, intimate life. For some individuals, removing the pressure to achieve a particular outcome can actually make the experience more enjoyable. It allows the focus to shift from performance to connection, which is often where satisfaction truly lies. From a physical health perspective, there are several practical strategies that can make a meaningful difference. Maintaining overall health through regular movement, balanced nutrition, and adequate sleep supports the body's natural systems, including those involved in sexual function. Blood flow, nerve health, and hormone balance are all influenced by lifestyle factors. Even small changes, such as incorporating daily walks or improving sleep habits, can have a positive impact over time. For those experiencing dryness or discomfort, simple interventions like lubricants or moisturizers can significantly improve comfort. These are not signs of dysfunction, with tools that support the body, much like wearing glasses supports vision. When needed, medical treatments can be added to address underlying hormonal or tissue-related changes. The key is personalization. What works for one person may not be appropriate for another, which is why individualized care is so important. Seeking professional guidance is another critical step. If a healthcare provider does not initiate conversations about sexual health, patients can feel uncertain about bringing it up themselves. Yet these discussions are a legitimate and important part of medical care. If a provider seems uncomfortable or dismissive, it may be worth finding someone who is more open to addressing these concerns. Feeling heard and supported can make a significant difference in both diagnosis and treatment. Education also plays a powerful role, not only for individuals, but across generations. When people understand their bodies and the changes that can occur over time, they are better equipped to respond with confidence rather than fear. Sharing accurate information with partners, friends, or family members helps normalize these experiences and reduces the stigma that often surrounds them. Over time, this openness can create a culture where sexual health is viewed as a natural and important aspect of overall well being. It is also helpful to approach this journey with patience. Changes in sexual health often develop gradually, and improvements may also take time. Whether through medical treatment, therapy, or lifestyle adjustments, progress is rarely immediate. However, consistent, thoughtful effort tends to yield meaningful results. Many individuals who seek help report not only improvements in physical comfort and desire, but also a renewed sense of confidence and connection. Perhaps one of the most reassuring truths is that intimacy can continue to evolve in positive ways throughout life. It does not need to diminish with age or time. Instead, it can become more intentional, more communicative, and in many cases, more fulfilling. When individuals understand their bodies, address concerns openly, and seek appropriate care, they often find that their experiences improve in ways they did not expect. At its core, this conversation is about recognizing that sexual health is not separate from the rest of your life. It is intertwined with how you feel physically, emotionally, and relationally. By approaching it with curiosity, compassion, and a willingness to learn, you create the opportunity for a healthier and more satisfying experience. And perhaps most importantly, it is a reminder that no one is alone in these experiences. What may feel deeply personal is often widely shared, even if it is rarely discussed. By bringing these topics into the open, we move closer to a more informed, supportive, and understanding approach to health, one that acknowledges the full spectrum of what it means to live well at every stage of life.